Good day, ladies and gentlemen, and welcome to your American Hospital Association's webinar, A Physician Leader's Role in Becoming a High-Performing Health System. All lines have been placed on a listen-only mode, and the floor will be open for questions and comments following the presentation. If you would like to submit a question or comment at any time during the webinar, you may use the chat box located on the lower right-hand corner of your screen. If you should require assistance throughout the conference, please press *0 to reach a live operator. At this time, it is my pleasure to turn the floor over to your host, John Combs, Senior Vice President and Chief Medical Officer for American Hospital Association. Sir, the floor is yours.
Thank you very much, Karen, and thank you all for joining us today for our webinar on the physician leader's role in becoming a high-performing health system. This webinar is brought to you by the American Hospital Association's Physician Leadership Forum in partnership with Truven Health Analytics. And to present today's session, we're pleased to have with us from Truven Health Analytics, Dr. Byron Scott, Associate Chief Medical Officer, and Jean Chenoweth, Performance Improvement and 100 Top Hospital Senior Vice President. Also joining us today are two physician leaders who have been integral in the work of their respective health systems in achieving high performance. From Asante Health, we have Dr. Jamie Grebosky, Vice President of Medical Affairs, and from OhioHealth, we have Dr. Bruce Vanderhoff, Senior Vice President and Chief Medical Officer. With that, I will turn it over to Byron to get us started. Byron?
Hey, good morning, everyone that's calling us from the Pac West and the West Coast, and good afternoon to everyone in the Midwest and the East Coast. I want to thank everyone for taking time today to join us for this webinar on the physician leader's role in becoming a high-performing health system. You know, and in the mission of the Physician Leadership Forum, which is to engage and partner with physicians to collaborate, advance excellence in patient care. We have a couple of great presenters today from a couple of very high-performing health systems. Just to kind of go over some of our key objectives, we're going to start off and I will lead a discussion about key factors in the development and success of physician leaders and health systems. And then my colleague Jean Chenoweth is going to talk about characteristics of high-performing health systems and the journey to measure leadership impact. And then we're going to kind of really get into what I consider the meat of this webinar. We're going to have Dr. Grebosky from Asante Health and Dr. Vanderhoff from OhioHealth really give an overview of some of the things that they've done to really drive performance in their systems.